MyVEGAS magazine owner and publisher Mark Shaffer has been devoted to showcasing the very best that Las Vegas has to offer. And today he's introducing us to the local doctor and owner of Crestview Dental, Dr. Adam Lousignont, to discuss the connection between oral health and cognitive impairment, such as dementia. Welcome to you guys.
Hey, thank you. Thanks for having us. It's great to be here.
So tell me a little bit, Dr. Adam's come by and obviously, dental health is very important.
Yes, well, they say your smile is your signature these days, but a lot of people don't look at the health aspect, and the health aspect is so important, so we brought in the doctor to talk to us a little bit about that.
So Adam, tell me a little bit more. I mean, people would obviously think about going to the dentist to go for a cleaning and make sure that they've got their fillings up to date, but it goes much deeper than that, right? It's a good point, a starting point for your actual general health.
Oh, absolutely. I mean, I love a beautiful smile. Who doesn't? And that's why a lot of people come to see me. But what I'm really, really passionate about is oral health and how it affects our systemic health and our bodily health.
So can you explain what the beginning of periodontal disease or gum disease actually is?
Yeah, so I mean, in a word, like you said, it's gum disease, but it's a more advanced form of gum disease. Sort of the earlier milder form, we call that gingivitis. But as that progresses, we start to see a loss of what we call the periodontal attachment. Periodontal attachment comprises the gum tissue, the ligaments, and the actual underlying jaw bone. So those things start to go away. And as they go away, eventually there's only so much of that stuff to hold our teeth in place. Mm-hmm. We start becoming at risk for tooth loss. And what we're finding these days is that there is actually a fairly strong connection between periodontal disease untreated and cognitive decline and impairments such as in dementia, and of course what we seem to be most familiar with in terms of dementia is Alzheimer's disease. Mm-hmm. is the most common form of dementia.
So is there an inextricable link between those starting points for periodontal and gum loss and dementia itself? Are you saying that that's the first stage along the path to what potentially could be happening?
Well, medicine science is interesting. We have to draw a distinction between correlation and causation. Correlation would be to simply say, well, maybe someone who is very, very on top of their oral health is just a health nut altogether. So there's a correlation there that, they take really good care of themselves. So of course they're less likely to have these other things. Versus causation, saying periodontal disease untreated is causing dementia. Now, what we see is that we can't exactly say with positivity that periodontal disease causes dementia, but the link seems stronger and stronger as time goes on. And it's concerning, to say the least. Certainly enough so that we want to prioritize our oral health.
Yeah, I mean, some people would say that, aging, it's part of life. People lose teeth, just like kids lose teeth, adults as they get older lose teeth, but there's something more significant to it than that. That could be a warning sign, a precursor to something more serious, maybe.
Oh, absolutely, absolutely. So one of the major offenders in periodontal disease is a bacteria that we call Porphyromonas gingivalis. Okay, big word.
That's very easy for you to say.
Yeah, but we can see how important it is to our gum health. It actually has the word gingiva in it, okay, which means our gums. And this bacteria produces a very damaging enzyme called a protease that breaks down proteins in our body. We see that it breaks down proteins in our gum tissue, but we've also found this in very high concentration in the brains of people with Alzheimer's disease.
Wow.
And we find that in the brain, this protease, which we call gingipane, is it's cytotoxic, meaning it kills cells. So the connection is there. And, again, we certainly want to use this not as a point of panic by any means, but just something to be informative, to help us understand that the mouth is not a separate entity from the rest of our body. Mm-hmm. Dentistry is not separate from health care. These are connected systems, and we have to prioritize them as a connected system.
Wow. These are all important points, and hopefully this will make someone realize they need to go and see their dentist today rather than putting it off for another 2 or 3 months. So thank you for that great information. Mark, you also always come with great information. I understand
Yes.
You have a bit of a surprise for everyone who's watching today.
We do. We have a lot of great restaurants in MyVEGAS magazine, and today we like to give away a dinner for two to some lucky person out there. If you're watching, MyVEGASgiveaway.com. Go there, sign up. You could win a dinner for two today.
You can win a dinner for two and also go visit your dentist. I can't stress that enough. For more information about Crestview Dental, head to crestview-dental.com, and to learn more about MyVegas magazine, visit myvegasmag.com.